I've been taking care of patients at White River Medical Center for 33 years. And in that time, it has been an honor to take care of families, and in fact, generations of families. Some of these children that I've taken care of are now having their own children that I've taken care of. This is what makes it special to have this place in our community, and everyone putting their trust in all of our team is very, very special for White River.
Over the years, so much has changed, but one thing hasn't. We show up the same way every day for our patients, with compassion, respect, and commitment to do what's right.
Well, I was here for 28 years, starting in 1991. And so I think that the contribution was multifold. One, of course, is that we increased access to medical care for a lot of people in this north central area. You know, when I came here, most of the leadership here viewed the hospital's role was more in the Batesville, Independence County area. And one of the things I think we did from the beginning was to create outreach. We started opening primary care clinics in remote locations like Newark and Cherokee Village and Drasco and Pleasant Plains and multiple of others as well. And so all of a sudden we had people having access to medical care that previously just didn't have them. So I'd say that's from a quality or access to care that was one of the biggest contributions. But there were a lot of other contributions we did too. The hospital for those some 28 years and since then has been really an economic engine for the growth of this community. By increasing the volumes of patients here, we were able to have monies coming to Batesville that had previously gone elsewhere. Medicare, Medicaid, private insurance, individuals going elsewhere for medical care, but staying locally. That really had an infusion of a lot of cash and revenue that we were able to, as a nonprofit organization, reinvest that within the community by expanding the facilities, hiring more people. When I came here, we had less than 500 employees, and when I retired, we had just short of 1,700 employees. So you think about that, that's like a whole big industry coming into Batesville over that period of time. And not only that, but one thing we found out early in my tenure is that those employees that are born, raised, and educated in Batesville are the ones that are likely to stay here. I think that the other things that I'm really proud of is that we did a lot in education itself. Like we worked with UACCB to develop nursing programs. UAMS came in and we did the residency programs, and so we elevated the opportunities for people to get education, and as a result, the whole quality of care in the hospital improved. And that's validated by a lot of things. One is people now use the hospital that didn't use it earlier. But also, it was validated by, we won the Governor's Quality Award one year, and repeatedly we've received quality recognition over the years. So I think when you look at all of those things, economic engine, you look at the quality of health care, you look at increased employment, higher paying jobs. When industry looks for where they want to place a plant, or where people want to go live, one of the key characteristics that they're looking at community is the access to quality medical care. And so during this period of time, that's obvious, that this community has grown not only in numbers, but the types of jobs that are here now that weren't here before. And I think that's a real tribute to what this hospital has done over my tenure and since then as well. So, but none of this happens without a vision. And the one thing I noticed when I came here is this board of directors, the management and the medical staff was committed to a vision of growth, a vision of providing better care to the residents of the area. So it's a real tribute to this medical community that I think is unique, that not only do they have real support and allegiance to this Batesville area, but they had a bigger vision too, where they saw the need to have access to medical care in the remote locations as well. It's really a great attribute of this medical community. When we went to White River Health, it was really a result of gaining or purchasing Mountain View Hospital, Stone County Medical Center, and so all of a sudden you weren't a single hospital system, you were multi-locations. And so the health system just gave a different perspective of it's not just a parochial care, but more of a regional care. So that sort of was a springboard to that thinking that we're not only in Batesville, we're in Mountain View, and subsequent to that, we were in a major facility improvements over in Newport, and so we kind of, it's just more of a what do you want to be when you grow up type thing, and so it went from a hospital to a system, giving more of an expanded view, expanded vision of what this institution could be.
While our commitment hasn't changed, the way that we deliver care has evolved, so we can continue to meet the healthcare needs of this community for the next 50 years. And we're very thankful for all the community support that we've had as an organization, because we couldn't be the organization we are today without support from a good community like Batesville and the surrounding areas.